So when I think about genetic testing, I tend to categorize them. So there are tests that are available through your physician. So whether that be your treating oncologist, a genetic counselor, a primary care physician, gynecologist. And so those provider ordered tests are what we call germline genetic testing, or we also know there's another form of genetic testing, which is called tumor testing. And so I want to talk a little bit about the difference between those two. So when we think of the types of testing that gets ordered by your physician, so we think about a patient who has cancer, who's currently going through surgery or treatment. A lot of times, oncologists or surgeons will order what we call tumor testing. And so tumor testing is really looking to see if there are any what we call mutations or genetic changes that could help us understand what type of targeted treatment we can use. And so this particular type of testing is looking for what we call somatic mutations, or mutations that are specific to the tumor that aren't necessarily mutations that we're born with. And so, as I mentioned earlier, a lot of times having this knowledge can help oncologists understand how to best treat or target the specific type of cancer you have. With the tumor testing, there's also another form of testing called germline genetic testing. And what germline genetic testing is, it's usually looking through your blood or your saliva to figure out if you have any of these mutations or genetic changes that you can be born with. And so sometimes mutations are there from what I tell patients from day one, right? And they're going to be there until the day we pass away. And so it's something that gets passed down to us. So it's inherited usually from a parent. And so what my role is really providing that type of testing to patients, understand if they have an inherited risk for cancer. And I will say that this type of testing can be applicable for patients going through cancer, but also for patients who've never had cancer in their lifetime, but maybe have a strong family history of cancer. And so these types of patients, are able to get this type of testing who may qualify based on their personal or family history of cancer. And so this is something that we're able to test for to figure out if they may have an increased risk for cancer that they're unaware of. And as a result of that, we can often change their management, which can include their screening or potentially having interventions like surgery to combat that risk. With genetic testing, of course, there's not only physician ordered tests out there. Some of you may be familiar with some of the direct to consumer testing, as we call it, or DTC, which includes things like 23andMe, Ancestry.com, other online health tests. And so with these tests, I will say, these aren't often ordered by a physician. Many of you probably have ordered them yourselves online. It's as simple as adding to your cart, right? And so with this type of testing, sometimes it can provide health information. And so this type of testing sometimes is more convenient for patients to be able to order themselves. Although I will say that a lot of times this type of testing isn't necessarily as comprehensive as far as the diagnostic tests that your physician would order.